Good afternoon, everybody. Please be seated. I want to thank Dr. Frieden and everybody here at the Center for Disease Control for welcoming me here today. Tom and his team just gave me an update on the Ebola outbreak in West Africa. Our efforts to help mobilize the international community to fight it, and the steps that we're taking to keep people here at home safe. Tom and his team are doing outstanding work. Between the specialists they have on the ground in West Africa and here at headquarters, they've got hundreds of professionals who are working tirelessly on this issue. This is the largest international response in the history of the CDC. After this, I'll be meeting with some of these men and women, including some who recently returned from the front lines of the outbreak, and they represent public service at its very best. And so I just want them to know how much the American people appreciate them. Many of them are serving far away from home, away from their families. They are doing heroic work and serving in some unbelievably challenging conditions, working through exhaustion day and night, and many have volunteered to go back. So we are very, very proud of them. Their work and our efforts across the government is an example of what happens when America leads in confronting some major global challenges. Faced with this outbreak, the world is looking to us, the United States, and it's a responsibility that we embrace. We're prepared to take leadership on this, to provide the kinds of capabilities that only America has, and to mobilize the world in ways that only America can do.
When it comes to Ebola, the first thing you need to know is that dying from the virus is like something out of a horror movie. It's extremely painful and terrifying. First you get a fever, then uncontrollable diarrhea, then you begin hemorrhaging blood. And while all that's hitting you, you lose touch with reality and become delirious. Finally, within days, you are dead. West Africa is currently in the midst of by far the worst case of the disease since it was first discovered in Africa back in 1976. This year's outbreak has been traced to a 2-year-old boy who died on December 6, 2013 in a village in Guinea. He probably got the virus by eating contaminated food that had been drooled or defecated on by a bat, or, as is common in this part of the world, had eaten some bat for dinner. Bats, researchers believe, are the carriers of the disease. As if the 2-year-old's death wasn't tragic enough, a week after it killed him, it killed his mother, his 3-year-old sister, and then his grandmother. Now, it's customary in some African villages to prepare a body for burial through the extremely sanitary cleansing ritual that involves evacuating the body of all food and excreta, often using just bare hands. Since the disease is spread by bodily fluids getting into the eyes, nose, or mouth, it's no surprise that 2 people who traveled to the grandmother's funeral caught Ebola and brought it home to their villages. After escaping Ground Zero, the highly contagious, undetected virus was off to the races. By the end of March, Ebola had reached Liberia, and in June, the first case was reported in Monrovia, Liberia's capital city. That's when outbreaks like this really start to spread, when the infected people make their way to population centers during the incubation phase, before their symptoms begin. A group of people from Sierra Leone who had traveled to an Ebola victim's funeral brought the disease back across the border, and in late July the virus had hit Sierra Leone's capital, Freetown. Guinea, Liberia, and Sierra Leone are 3 of the 17 nations that form the Economic Community of West African States, whose combined territory is roughly half the land area of the United States, but with a population roughly the same at 340 million, it's about twice as dense as America. And since the disease is easily passed from person to person, and there are lots of people here, it's crucial to get outbreaks like this under control as quickly as possible, especially since a staggering 47%, or 2,984 of the just over 6,400 people who have been sickened by this strain of Ebola have died. So understandably, this is terrifying to neighboring countries, who have responded by shutting down their borders. Still, Nigeria, the largest country in Africa by population and economic output, couldn't keep the disease beyond its borders when an infected Liberian American man named Patrick Sawyer flew into Nigeria's largest city and died shortly thereafter. A Nigerian doctor named Stella Ameyo Adedeva stopped Sawyer from leaving the hospital, stopping the spread of Ebola to the 21 million people living in Lagos. Sadly, Dr. Adedevo contracted Ebola and died, but she left this world a hero by helping to successfully limit the outbreak to just 21 cases and 8 deaths in her country. No new cases have been reported in Nigeria in weeks. Liberia's experience, however, has been the exact opposite. The disease is out of control there. Cases doubled in the 3 weeks between August 31st and September 22nd. As a response, Liberia's Harvard-educated president, Nobel Peace Prize winner Ellen Johnson Sirleaf, the first female head of state in the history of Africa, had no choice but to order a lockdown of a highly infected slum in the capital. This didn't last long, though, as an angry crowd attacked an Ebola center and freed the infected. The second hardest hit country, Sierra Leone, has resorted to an unprecedented 3-day nationwide lockdown of its 6 million residents in an effort to halt the disease. But these countries are fighting an uphill battle. Many parts of West Africa lack even proper sanitation or drinking water. Too many people are poorly educated, scared, and mistrustful. To add insult to injury, aid workers keep getting attacked for spreading information about Ebola or trying to collect the bodies of the disease's victims. And in September, an entire team of 8 aid workers was murdered by villagers in Guinea. When American healthcare workers in Liberia contracted the disease and had to be flown to the United States for life-saving treatment, the rest of the world was shaken by the possibility of Ebola spreading outside of Africa's borders. It was the first time an Ebola-infected person had stepped foot on American soil. But it wasn't the first time someone on Western soil had been infected. In 1976, the year of the first documented Ebola outbreak, a British scientist named Geoffrey Platt, researching the disease in a lab in England, accidentally stabbed himself with a syringe containing the virus. As the unmistakable symptoms of Ebola set in over the next few days, the British government acted swiftly. Platt was transported in a special ambulance, under police escort, to a London hospital where he was the lone patient. He was kept in an isolation chamber, and all hospital staff working on his case were quarantined, as was his family and any lab workers and friends he had come in contact with. The extreme action worked. Platt recovered without infecting anyone else. But the current incarnation of Ebola is threatening to overwhelm the much more economically challenged West African region. Answering the call to action, the United States military is taking the lead in overseeing and coordinating the response to the epidemic. In addition to U.S. Centers for Disease Control and Prevention staff who have been there for weeks, President Obama has ordered 3,000 American troops to West Africa to build 17 100-bed treatment centers and a site capable of training 500 healthcare workers a week. The U.S. response is worth an estimated $750 million over the next 6 months. The Bill and Melinda Gates Foundation has alone donated $60 million, and the foundation of Paul Allen, Gates' co-founder of Microsoft, has given nearly $12 million. The American-led international response may come just in time, as infection levels were spiking exponentially in the middle of September. If no help had come, some experts were fearing the disease could have overwhelmed the region and spread until it exhausted its host population, killing hundreds of thousands or even millions of Africans, all the time increasing the odds that it could make its way off the continent. The World Health Organization now optimistically hopes to control Ebola by mid-2015, limiting the death toll to around 10,000.
That's what we're doing as we speak. First and foremost, I want the American people to know that our experts here at the CDC and across our government agree that the chances of an Ebola outbreak here in the United States are extremely low. We've been taking the necessary precautions, including working with countries in West Africa to increase screening at airports so that someone with the virus doesn't get on a plane for the United States. In the unlikely event that someone with Ebola does reach our shores, we've taken new measures so that we're prepared here at home. We're working to help flight crews identify people who are sick, and more labs across our country now have the capacity to quickly test for the virus. We're working with hospitals to make sure that they are prepared and to ensure that our doctors, our nurses, and our medical staff are trained, are ready, and are able to deal with a possible case safely. And here I've got to commend everybody at Emory University Hospital. I just had the opportunity to meet with Doctors Gartland and Ribner and members of their team, and the nurses who, sorry doctors, but haven't been in hospitals. I know they're the ones really doing the work. And I had a chance to thank them for their extraordinary efforts in helping to provide care for the first Americans who recently contracted the disease in Africa. The first 2 of those patients were released last month and continue to improve. And it's a reminder for the American people that should any cases appear in the United States, we have world-class facilities and professionals ready to respond, and we have effective surveillance mechanisms in place. I should mention, by the way, that I had a chance to see Dr. Brantley in the Oval Office this morning, and although he is still having to gain back some weight, he looks great, he looks strong, and we are incredibly grateful to him and his family for the service that he has rendered to people who are a lot less lucky than all of us. As we all know, however, West Africa is facing a very different situation, especially in the hardest hit countries, Liberia, Sierra Leone, and in Guinea.
With some developing news, the Centers for Disease Control and Prevention confirmed late today that a patient being treated at a Dallas hospital has tested positive for Ebola. This would be the first official case diagnosed in the United States. Now, in a press conference, CDC Director Dr. Tom Frieden said that the patient arrived in Texas from Liberia earlier this month. He also said the patient sought care last Friday and has been hospitalized in isolation since the weekend. That being said, the director remained fairly confident that the virus would not spread. Take a listen.
The bottom line here is that I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country. It is certainly possible that someone who had contact with this individual, a family member or other individual, could develop Ebola in the coming weeks. But there is no doubt in my mind that we will stop it here.
Frieden also made it clear that there is zero risk to anyone who shared that flight from Liberia. He reminded the public that Ebola is not contagious until symptoms begin. And as far as we know, this patient did not see any symptoms until days after that flight. Details are forthcoming in this particular case. We'll continue to follow the story and, of course, bring you updates.
Tom and others recently returned from the region, and the scenes that they describe are just horrific. More than 2,400 men, women, and children are known to have died, and we strongly suspect that the actual death toll is higher than that. Hospitals, clinics, and the few treatment centers that do exist have been completely overwhelmed. An already very weak public health system is near collapse in these countries. Patients are being turned away. People are literally dying in the streets. But here's the hard truth. In West Africa, Ebola is now an epidemic of the likes that we have not seen before. It's spiraling out of control. It is getting worse. It's spreading faster and exponentially. Today, thousands of people in West Africa are infected. That number could rapidly grow to tens of thousands. And if the outbreak is not stopped now, we could be looking at hundreds of thousands of people infected, with profound political and economic and security implications for all of us. So this is an epidemic that is not just a threat to regional security, it's a potential threat to global security. If these countries break down, if their economies break down, if people panic, that has profound effects on all of us, even if we are not directly contracting the disease. And that's why 2 months ago, I directed my team to make this a national security priority. We're working this across our entire government, which is why today I'm joined by leaders throughout my administration, including from my national security team. And we've devoted significant resources in support of our strategy with 4 goals in mind.
The Ebola outbreak is on full alert in Dallas, Texas, and the Liberian national, who is known originally as Patient Zero, He's now been identified as Thomas Duncan. He flew in to the United States from West Africa on September 20th. And several days later, he walked into the Texas Health Presbyterian Hospital complaining about Ebola-like symptoms. He reportedly told a nurse he just came over from Liberia. They sent him home with a prescription for antibiotics. A few days later, he came rushing back to the same emergency room. One neighbor living nearby says that he actually witnessed Duncan vomit outside of his home near the corner of an apartment building. Now we have an unconfirmed report from a source who works in the hospital. We're working to confirm that source right now, but there is a claim that Thomas Duncan not only vomited all over his apartment, but that he also vomited inside the ambulance and later all over the emergency room floor. Of course, this is before EMTs knew that he was from Liberia. We believe that ambulance was also used to transport other sick patients before it was cleaned. And now we know that the man's family and several other people are in quarantine, with another 100 people being closely monitored by the CDC, and also unconfirmed reports that there are 80 people in quarantine and that the emergency medical center has gone underground into a bunker. So as the story continues to develop, returning to our regular guest on this program, his name is Robert Scott Bell. He's a well-known homeopathic practitioner. Robert, thanks for joining us.
Gary, good to be back with you on a very, let's say, a daunting crisis that we have to navigate here to really understand what is actually happening.
Now, Robert, we had you on just a couple months ago, and you had warned that the CDC was failing in the way that they diagnosed Ebola. What exactly happened in Dallas? How could they let an infected man who just walked off of a plane from Liberia walk out of the front door of a hospital after he was complaining of Ebola-like symptoms?
Well, this is part and parcel to our medical establishment here in America. When we talk about having a first world medical system, we like to pat each other on the back in America to say how much better off we are here. But when you see a patient coming from West Africa in the height of an Ebola scare and then released back into the community, you've got to question, is it gross incompetence, or is somebody trying to start something like a major pandemic outbreak here? Much less if this is indeed a viral issue. Why would you prescribe an antibiotic which could wipe out an immune system and basically precipitate illness? Now, it's possible that this may be a side effect from the antibiotic itself. We don't know. And when we mentioned a couple of months back about the way the CDC is tracking this thing, we still have that question again, because Tom Frieden of the CDC acknowledged that patient 0 was confirmed to have Ebola by PCR, polymerase chain reaction, which is amplifying unknown genetic material, fragments of genetic material, hundreds of millions of times to identify the infecting agent, which is not really a viable way of determining an infecting agent. If it's really present, if this man is overrun with Ebola, you would be able to find millions of replicant viral copies, isolate it, and say, yeah, indeed, this is the case here. They have not come out and admitted that or acknowledged that. Yet at the same time, the concern I have here, whether this is real or not, the very fact that they let the man out into the community precipitated this response to now begin to lock down and quarantine people in the community, and it might not be necessary. These are the same medical authorities that screwed up to begin with. Can we rely upon them to do the right thing here should an outbreak actually occur?
Robert, we reported today that there's a case in Hawaii. Somebody has Ebola-like symptoms there. I just received word just before this interview that 2 people in Kentucky have now been suspected with Ebola. Now we know, of course, at least 100 people are being closely monitored, and we're still working on to confirm the 80 people in quarantine by the CDC. What about Obama's executive orders? We've talked about this on the program. The National Guard does have the power to force people into mandatory quarantine zones for diseases like Ebola. Is what's happening simply hysteria, or can we see this unfolding?
Well, it's a precautionary tale in real time. We're living through this, and because of my suspicion of the inadequacy or incompetence of the medical establishment at this point, I'm doubly concerned that this may be just being played out so that the Americans will give up the last remaining rights that they have of self-autonomy, to be able to move about and care for their families, to work, shop, to do what they need to do to survive. Now, there is a legitimate reason for quarantine if this is established to be an actual Ebola or other highly infectious agent. You could warrant that and say it's a legitimate issue. But there's so many questions about the way that the CDC and the medical authorities have identified or not identified and then released into the community and then grabbed back from the community and now going after others. In that case they said there was 100 suspected. As of yesterday, we reported 14 were tested, only one came up positive, which would indicate, if they test 100, maybe 4 or 5 others just theoretically at this point. But again, if they're relying on PCR, I'm highly suspicious of the claim that it is indeed what they are claiming. Now, this is not to say that there may be a legitimate threat, but the disempowering of the American people through this fear factor, if you will, approach is not really helping, because the responsible among us don't want to be out in a communicable situation, or if we've been identified as potentially communicable, to go out and spread this to others. But the question is this being done legitimately? The suspension of rights. We saw what happened in America during World War II, the internment of Japanese Americans at that time, based on a war issue, but the suspension of the Constitution. Is this another situation where the government will take advantage of a false biological flag operation? That is a question that must be asked.
Robert, several years ago, the swine flu and SARS, these types of viruses were being blown out all over the media. There was talk of forced vaccinations. I even actually produced a documentary film that covered the topic. It was called Enemy of the State. And I'm asking you now, do you see parallels to what is happening right now at the onset of this diagnosis in Dallas and what took place several years ago with the swine flu?
Yeah, I do see a Hollywood script being played out at CDC. Remember in 1976, this is the same organization that claimed 500,000 or 1 million Americans might die of the swine flu if we don't rush into production of vaccine. Now, that swine flu debacle may have contributed to the inability of President Ford at the time to win election in the next year. It turned out that 500 or more people were injured or killed by the vaccine itself. The swine flu was a dud. So this is an ongoing operation that happens at CDC to justify its budget and its existence. And we've seen it time and again. And that's why I am suspicious of this scenario as well. Playing itself out. We've seen the.
Well, you were just speaking about President Ford. I'm speaking about just what happened a couple of years ago. It actually was the bird flu.
Oh yeah, no, that is indeed the case. I agree. I just wanted to go back for a historical precedent to show you that this is not just a recent phenomenon. With the claim that the swine flu was going to be bad, or a bird flu of some form that was going to be a pandemic level 6 that they had to redefine at the WHO, the World Health Organization, we see a lot of these operations that are designed inevitably to elevate the stock prices of the vaccine and pharmaceutical drug manufacturers. And I find it highly suspicious that just a couple of weeks into this thing, suddenly there was an experimental Ebola vaccine by GSK, I believe, at the NIH and CDC, I think share patent as well, going into human clinical trials. This would have taken normally years to have that happen. So how is this happening so quickly? There's a script that's running here that makes me very suspicious. Again, I'm not dismissing the possibility that this Ebola scenario may be real here, but there's something else going on that is causing this, let's say, ineptitude to come to the surface. Why would the hospital release this so-called patient zero out when on his chart it was, the nurse claimed to have acknowledged that the guy came from Liberia in the midst of an Ebola outbreak? That is outrageous. Now, that's again either gross incompetence or they're trying to allow this to happen.
Now I want to get into the symptoms and what happened in the ambulance and in the ER, but I've been getting a lot of reports. People send me, I get a lot of email, and one email I recently received made a startling claim that Ebola is actually patented. Do you have any information on that?
I don't have it validated. I've read reports on that as well. I don't put it out of the realm of possibility. We've seen that their own CDC is engaged in, for instance, if you don't call it weaponizing, they've admitted to trying to test and genetically engineer or modify influenza viruses to see if they can duplicate the virus, for instance, that was credited with the Spanish influenza of 1918. So to say that it's not possible that it's a patented new virus, I couldn't dismiss that outright. But I will say that what's completely ignored here is the way disease manifests in a body. It's not so much the contact alone that's enough. You have to have a willing host. You have to have a host that is deficient in minerals. You have to have a host that is intoxicated and poisoned, having their gut flora decimated by either consuming water that is contaminated because there's no sanitation or proper sewage treatment facilities, or because they've been decimated by drugs or vaccines and heavy metals. So that's why I discount the potential that this is going to kill everybody that it comes into contact with. We've already seen people that supposedly had Ebola have survived it, particularly those that they flew here into America. Why they needed to do that, I'm not certain. But again, it has me causing, let's say, the questioning of what is real, what is not real in this case.
Now, Robert, let's talk about what happened in the ambulance and the ER. If this man really did vomit all over those areas, what kind of danger are the people that came in contact in?
Well, depending on susceptibility, what's the point of entry? Do they have mucous membranes that are intact? Do they have an intact immune system or not? This is not discussed. It is automatically assumed that if you come into contact with bodily fluids in some way that you will definitely come down. They claim an incubation period around 3 weeks. In that time frame, what do you do also matters. Will they open up to the reality that there are botanical ingredients, essential oils, silver, and other things that can neutralize viruses or stop them from replicating? So these are factors that they're not going to consider, I would, immediately. And of course, the fact that homeopathic medicine has been successful in addressing many of these pandemics and epidemics throughout history since homeopathy's inception over 200 years ago at least. But in the context of the average American who is selenium deficient, who may have been on antibiotics a number of times in the past year, I do have concern for susceptibility of those who have been exposed to these bodily fluids materials, the things that are vomited up. They do concern me. They are vector points of transmission that are legitimate.
Now, Robert, for several days, CDC Director Thomas Frieden has said the virus will not break out in America. As I mentioned, now we're seeing 2 potential cases pop up in Kentucky, another one in Hawaii. If more patients are infected and it spreads beyond Dallas, as it appears it may have done, should he lose his job?
Yeah, I would agree. I think gross incompetence on the part of the head of the CDC, although that's, for me, nothing new. I'm not picking on any one person, but in this case, this Tom Frieden is not doing what I think is an adequate job. Of course, they also do not allow the toxicologists to ever discuss the realities of the, let's say, suppression of immune function due to poisons in the environment. And that's another, I think, irresponsible aspect, because they do have intelligent folks at CDC that do a good job, but they're never allowed to discuss it because the focus is only on the virus, only on the germ, and there's a fear operative focus. When you do that, when you discount the potential for clearing the terrain, for making the people healthy, for strengthening immunity as a vector of protection rather than transmissibility. So they're only giving half of the story, and it's the one that incites and induces fear. And of course, by ratcheting fear, you burn out adrenals and you weaken immunity, so you actually precipitate the very transmission that you claim to want to prevent.
Well, that's a fascinating parallel you just drew. Robert, we are really up against the clock, but if you can, before we go, can you give our viewers just a couple real quick tips on what they can do to perhaps prevent any type of infection in their own lives?
Well, as evidenced by a 1995 peer-reviewed publication out of Africa with one of the strains of Ebola that are referencing now, the use of selenium supplementation was given there, and it reversed Ebola. It literally reversed it because they found in a large number of cases there were gross selenium deficiencies. And I agree in this continent as well that we have some level, although not as severe, of selenium deficiencies. The basic common sense hygienic practices, of course, soap and water, hand washing. The use of colloidal silver or bioactive silver hydrosol is a legitimate mechanism and means by which we can stop transmission or halt the replication of the virus.
We've devoted significant resources in support of our strategy with 4 goals in mind. Number 1, to control the outbreak. Number 2, to address the ripple effects of local economies and communities to prevent a truly massive humanitarian disaster. Number 3, to coordinate a broader global response. And number 4, to urgently build up a public health system in these countries for the future. Not just in West Africa, but in countries that don't have a lot of resources generally. Now, this is a daunting task, but here's what gives us hope. The world knows how to fight this disease. It's not a mystery. We know the science. We know how to prevent it from spreading. We know how to care for those who contract it. We know that if we take the proper steps, we can save lives. But we have to act fast. We can't dawdle on this one. We have to move with force and make sure that we are catching this as best we can, given that it has already broken out in ways that we had not seen before. So today I'm announcing a major increase in our response. At the request of the Liberian government, we're going to establish a military command center in Liberia to support civilian efforts across the region, similar to our response after the Haiti earthquake. It's going to be commanded by Major General Gerald Williams, a commander of our Army forces in Africa. He just arrived today and is now on the ground in Liberia. And our forces are going to bring their expertise in command and control, in logistics, in engineering.
Well, a new study released by the CDC on September 26th, that's 4 days before we learned of patient 0 in Dallas. That new study posits that the number of cases in Liberia and Sierra Leone are growing at a much faster rate than previously thought. And of course, it is not under control, it is ever expanding.
Hey, Dr. Colbert here, and there's a lot of fear concerning the Ebola virus, so I'd like to give you some facts so it can relieve your fears. First of all, approximately 21,000 people are presently infected with the Ebola virus, and the CDC predicts that by January of 2015, 1.4 million people will be infected. Now that's a huge jump in just 3 months. In fact, that's the entire population of the state of New Hampshire.
Now, the latest on the Ebola outbreak in West Africa, which is moving faster than efforts to contain it. The disease has struck hard in 3 countries, Guinea, Liberia, and Sierra Leone, which is the epicenter. A Liberian government official who had flown to Nigeria's largest city, Lagos, died of the disease in a hospital there. 2 American aid workers infected in Liberia, 33-year-old Kent Brantley and 59-year-old Nancy Wrightball, will be sent home for care at Emory University Hospital in Atlanta. It is the first time any Ebola patient has been sent back to the U.S. for treatment.
Outside the John F. Kennedy Hospital in Monrovia, Liberia, 20-year-old Ibagasti Wo is sick.
In Dallas, there is no sign Ebola is spreading, but the fear of Ebola definitely is.
Stay with CBS 11 for continuing coverage of Ebola.
The first case of Ebola in America dominates on TV, on radio,
government and health officials in Dallas are trying to reassure the public that...
and online, like this post on Twitter. Everyone in Dallas better get to their nearest hospital and quick. I don't care if you feel fine. I want this thing contained. News that several children had been in contact with the Ebola victim and then attended area schools has frightened many parents.
We're questioning right now as we're walking to school whether I'm going to let him go, and I'm heading towards not letting him go to school today.
She's not alone. Attendance at the affected schools is down.
For those 5 schools, it's 86% attendance. It's usually around 95-96%.
You might expect Ebola fear, concern of an Ebola outbreak, would have people flooding emergency rooms and clinics. Health officials say that hasn't happened so far.
Do you worry it could spread?
Yes, I am worried about the spread. Because kids go to schools, everybody go to church, everybody go to market.
Not everybody's Ebola fear is the same. For instance, in this community, closest to the patient now being treated, it's mostly immigrants. Their fears are, what if there's a stigma attached to the disease? What if they were banished? What if they were quarantined? How would they go to work? How would they pay their bills? How would they survive? That really scares them. To try and calm public concerns and provide answers, Dallas activated its Emergency Operations Center, normally reserved for disasters. But it got off to a rough start with frustrated reporters.
Wouldn't you want to keep them all in one place? I would keep them in the apartment.
Fear has even come to the fair, as in the State Fair of Texas, triggering concern it could hurt attendance. Extra hand sanitizer has been put out for visitors. Even iconic Big Tex has added a line to his usual Texas howdy.
Always wash your hands before eating.
The Liberian Daily Observer, which is the largest newspaper in Liberia, just published an article on their front page with the headline, Ebola AIDS manufactured by Western Pharmaceuticals, US DoD. The article basically accuses the US of manufacturing this Ebola outbreak in what they call an American military medical industry scheme to use Africa as a testing ground for bioweapons. The article was written by Dr. Cyril Broderick, a professor who's taught at different colleges, including the Agricultural College of the University of Delaware. In the article, he urges African leaders to not let their people be Western guinea pigs. He accuses the Centers for Disease Control and Prevention, Tulane University, the U.S. Army, and others as all being connected to this bioweapons testing plot.
And now to the latest on the first case of Ebola diagnosed in the United States. New today, we know the patient's name now. He's Thomas Eric Duncan. He remains in serious condition this afternoon at the hospital in Dallas.
We also learned today that Duncan came into contact with as many as 18 people between the time he left Liberia on September 19th, including 5 Dallas students from 4 different schools. He arrived in Dallas via DFW on September the 20th. And we've just learned United Airlines now believes Duncan flew to DFW from Washington Dulles Airport on Flight 822. Governor Rick Perry held a news conference this afternoon in Dallas. He says those students are being monitored at home, but the governor also says so far none of them has shown any symptoms.
These children have been identified and they are being monitored, and the disease cannot be transmitted before having any symptoms.
The CDC is also monitoring Duncan's family members and the ambulance crew who transported him to the hospital. How Duncan's case has been handled is raising some questions about Texas Presbyterian Hospital in Dallas and what they knew. The doctor from the hospital says Duncan walked into the ER on September the 26th. A nurse asked him if he had been out of the country, but that information apparently was not relayed to other medical personnel. Duncan did have a blood test, but not an Ebola screening, and was sent home with antibiotics. 2 days later, he was rushed to the ER with a high fever and nausea. Yesterday, doctors confirmed that Duncan tested positive for Ebola, and he is now in an isolation unit.
The fear of Ebola in affected countries and beyond is palpable. A man in Guinea suspected of having the gruesome disease was left lying in a city street for hours. Passers-by too scared to help, medical resources stretched thin.
Let them come and take him from here, because we are afraid.
More than 930 people have died in the outbreak. The military now helping combat the spread of Ebola in Sierra Leone. Liberian soldiers are clamping down on travelers. No one with a fever allowed in or out of the country. And in Spain, health officials reassuring the public there is little risk of Ebola spreading from an infected priest evacuated from Liberia, now in isolation at a Madrid hospital.
He is stable with fever, and the most important thing is that Father Miguel is not hemorrhaging. This is a sign of a positive prognosis.
The World Health Organization will soon decide if the Ebola outbreak is an international public health emergency, which could initiate a more global response. The CDC is operating on its highest alert level, the first time since the 2009 swine flu pandemic. The agency's director briefed representatives on Capitol Hill.
We, with our partners, have been able to stop every Ebola outbreak to date, and I'm confident that if we do what works, we will stop this one also. But it won't be quick, and it won't be easy.
Dr. Thomas Frieden says tried and true infection control methods, diagnosis, isolation, and tracing patient contacts are the best way to end the outbreak. Cindy Sharp, Associated Press.
As the medical world continues to grapple with Ebola, there are growing calls for experimental medicines to be used more widely. 2 American aid workers infected with the virus appear to be improving after receiving an unapproved medicine, ZMapp, ahead of their evacuation back to the United States.
This is an emergency compassionate use situation. This is not a well-controlled laboratory study. A lot of work remains to be done to see how it worked and why and how quickly. The apparent speed of recovery was faster than I would have expected, so there may be a lot of things that we still don't understand about the virus.
The antibodies were originally harvested from mice that had been injected with parts of the virus. Experiments on monkeys suggest the antibody cocktail may reduce fatalities when given after exposure to the virus. The proteins are then grown in specially modified leaves of tobacco, which act like a photocopier, reproducing larger amounts.
I do agree there's no vaccine. Treatment is experimental. The real way of stopping it is by transmission of the virus, which we know quite well how to do. It's just spreading that message and then providing basic supportive care to people who are being treated at the moment. What we must remember, it's a very isolating and stigmatizing disease, and people deserve to be treated with care and concern, which is what we're all committed to.
And our Department of Defense is better at that. Our armed services is better at that than any organization on earth. We're going to create an air bridge to get health workers and medical supplies into West Africa faster. We're going to establish a staging area in Senegal to help distribute personnel and aid on the ground more quickly. We are going to create a new training site to train thousands of health workers so they can effectively and safely care for more patients. Personnel from the U.S. Public Health Service will deploy to the new field hospitals that we're setting up in Liberia. And USAID will join with international partners and local communities in a community care campaign to distribute supplies and information kits to hundreds of thousands of families so they can better protect themselves. We're also going to build additional treatment units, including new isolation spaces and more than 1,000 beds. And in all our efforts, the safety of our personnel will remain a top priority. Meanwhile, our scientists continue their urgent research in the hope of finding new treatments and perhaps vaccines. And today I'm calling on Congress to approve the funding that we've requested so that we can carry on with all these critical efforts. Today, the United States is doing even more, but this is a global threat, and it demands a truly global response. International organizations just have to move faster than they have up until this point. More nations need to contribute experienced personnel, supplies, and funding that's needed, and they need to deliver on what they pledge quickly. Charities and individual philanthropists have given generously, and they can make a big difference. And so we're not restricting these efforts to governmental organizations. We also need NGOs and private philanthropies to work with us in a coordinated fashion in order to maximize the impact of our response. This week, the United States will chair an emergency meeting of the UN Security Council. Next week, I'll join UN Secretary General Ban Ki-moon to continue mobilizing the international community around this effort. And then, at the White House, we're going to bring more nations together to strengthen our global health security so that we can better prevent, detect, and respond to future outbreaks before they become epidemics. This is actually something that we had announced several months ago at the G7 meeting. We determined that this has to be a top priority. This was before the Ebola outbreak. We anticipated the fact that in many of these countries with a weak public health system, if we don't have more effective surveillance, more effective facilities on the ground, and are not helping poor countries in developing their ability to catch these things quickly, that there was at least the potential of seeing these kinds of outbreaks. And sadly, we now see that our predictions were correct. It gives more urgency to this effort, a global health initiative that we have been pushing internationally. Let me just close by saying this. The scenes that we're witnessing in West Africa today are absolutely gut-wrenching. In one account over the weekend, we read about a family in Liberia. The disease had already killed the father. The mother was cradling a sick and listless 5-year-old son. Her other son, 10 years old, was dying too. They finally reached a treatment center, but they couldn't get in, and said, a relative, "We're just sitting." You know, these men and women and children are just sitting, waiting to die, right now. And it doesn't have to be this way. The reality is that this epidemic is going to get worse before it gets better, but right now, the world still has an opportunity to save countless lives. Right now, the world has the responsibility to act, to step up, and to do more. The United States of America intends to do more. We are going to keep leading in this effort. We're going to do our part, and we're going to continue to make sure that the world understands the need for them to step alongside us as well in order for us to not just save the lives of families like the one I just discussed, but ultimately to make sure that this doesn't have the kinds of spillover effects that become even more difficult to control. So thank you very much to the entire team that's already doing this work, and please know that you've got your President and Commander-in-Chief behind you. Thank you.